12 Home Remedies for Stomach Pain. Several home remedies can help resolve stomach and abdominal pain, such as drinking water and avoiding spicy foods. If these do not help, over-the-counter and prescription medications are available. Common symptoms of an upset stomach and indigestion include 1. Heartburn, or acid reflux. 2. Nausea. 3. Bloating. 4. Gas. 5. Belching, sometimes bringing up bitter or foul-tasting fluid or food. 6. Farting. 7. Bad smelling or sour breath. 8. Hiccuping or coughing. This article looks at 12 of the most popular home remedies for an upset stomach and indigestion. We also explain when to speak with a doctor. What is stomach pain? Stomach pain is a pain or an ache that someone experiences anywhere between the chest and groin. This pain can vary in intensity and affect different areas of the abdomen, such as the 1. Appendix. 2. Liver. 3. Gallbladder. 4. Stomach. 5. Pancreas. 6. Bowel. Stomach pain can vary in intensity and has various causes. Causes of stomach pain. Abdominal pain may be due to more common causes such as gas, indigestion, constipation, and diarrhea. Infectious illnesses, such as the flu, may also cause abdominal pain. More uncommon causes include 1. Pneumonia. 2. Myocardial infarction, or heart attack. 3. Strangulated hernia. 4. Peritonitis, an infection of the stomach lining. 5. Bowel obstruction. 6. Appendicitis. 7. Pancreatitis. 8. Kidney stones. 9. Ovarian cysts. 12 Home remedies. There are several popular home remedies for indigestion. Some may also help ease stomach upset from other sources, such as irritable bowel syndrome. 1. Drinking water. The body needs water to efficiently digest and absorb nutrients from foods and beverages. Being dehydrated makes digestion more difficult and less effective, increasing the likelihood of an upset stomach. Additionally, drinking water may help reduce heartburn. The Academy of Nutrition and Dietetics says that although the general rule of thumb is drinking 8 8-ounce glasses of water daily, a person's fluid needs can vary. Activity levels, elevation, extreme temperatures, general health, and size can all make a difference in fluid needs. Around 20% of a person's fluid intake will come from food, with the rest coming from beverages. For most people, a suitable figure to aim for is approximately 8 or more cups of water daily. Younger children require slightly less trusted source water than adults. 2. Avoiding lying down. Avoiding lying down may prevent indigestion from becoming heartburn. When the body is horizontal, the acid in the stomach is more likely to travel backward and move upward, which can cause heartburn. Therefore, people with an upset stomach should avoid lying down or going to bed for at least a few hours until it passes. 3. Ginger. Ginger may help reduce trusted source nausea and vomiting in people who are pregnant or those who undergo chemotherapy. Individuals with an upset stomach could try adding ginger to their food or drinking it as tea. Some all-natural ginger ales may also contain enough ginger to settle an upset stomach. Ginger tea is widely available to buy in supermarkets and online. 4. BRAT Diet. Doctors may recommend the bananas, rice, applesauce, and toast (BRAT) diet to people with diarrhea. BRAT trusted source foods may decrease the number of stools a person passes and help ease their diarrhea. As these foods are bland, they do not contain substances that irritate the stomach, throat, or intestines. Therefore, this diet can soothe the tissue irritation resulting from the acids in vomit. Many of the foods in the BRAT diet are also high in nutrients, such as potassium and magnesium, and can replace those someone loses through diarrhea and vomiting. 5. Avoiding smoking and drinking alcohol. Smoking and alcohol may trigger indigestion and other gastrointestinal conditions, such as gastroesophageal reflux disease, GERD. 6. Avoiding difficult-to-digest foods. Research trusted source suggests that the following foods may increase the risk of indigestion. 1. Fatty or acidic foods. 2. Wheat products. 3. Fruit and fruit juices such as watermelon. 4. Spicy foods. 5. Greasy foods. 7. Baking soda. Some healthcare professionals suggest that baking soda can help relieve heartburn and indigestion by reducing stomach acidity. 8. Figs. Figs contain substances that act as laxatives to ease constipation and encourage healthy bowel movements. Figs also contain compounds that may help to ease indigestion. 9. Aloe juice. Aloe vera may help trusted source reduce symptoms of irritable bowel syndrome and colitis, although the evidence for these benefits is slight and needs further research. 10. Basil. Basil contains substances that may reduce gas. Its leaves also contain levels of high linoleic acid, which has anti-inflammatory properties. 11. Licorice. Products that contain licorice root may help trusted source relieve digestive symptoms. However, experts are uncertain about the role of licorice in these products. Someone with an upset stomach could try drinking licorice root tea several times daily until their symptoms improve. 12. Rice. Plain rice may be beneficial for those with stomach pain due to irritable bowel syndrome, along with other low FODMAP food. Rice is also part of the BRAT diet that doctors may recommend. Medication for stomach ache. OTC stomach pain medications can help to relieve some symptoms. 1. Simethicone, Gas X, Mylanta, can help reduce bloating and gas pain. 2. Antacids and acid reducers like famotidine Pepcid, Zantac 360, can address symptoms of gastroesophageal reflux disease, GERD, acid reflux, and other signs of indigestion like belching, stomach fullness, or burning in the throat. 3. Stool softeners and laxatives like Ducosate, Colace, and Bisacodyl, Dulcolax, can help relieve feelings of fullness, bloating, and discomfort caused by constipation. 4. Loperamide, Imodium, can help address intestinal cramping and pain from diarrhea. Most OTC medicines to relieve stomach discomfort should not be taken long-term. If your symptoms come on suddenly or last for a long time, see a medical provider.